This video is to demonstrate using a one-handed technique to tattoo a patient, this time with a syringe attached to a safety needle. Michelle is going to start off by washing her hands. You always need to wash your hands first before you do any tattooing. Same materials as the last video. This time we're just going to use the syringe. We have a clean pair of gloves and a new mark on our patient. Again, we'll be using an 18 gauge safety needle and our tattoo ink. And this syringe that we're using as a small syringe is only 3 cc's. This tray would normally always be clean, and you want to use a clean sheet if you're setting your stuff on top of it. Again, this video is for demonstration purposes only. So Michelle's first going to pour the tattoo ink into our sterile red ink dwell here. You want to try and fill the ink dwell all the way to the top when you're using the syringe, because it takes a little bit of ink to get up into the syringe. She's going to disinfect the area with an alcohol swab. And she's going to assemble the syringe to the safety needle. Try not to touch the end of the needle. You want to attach it like she's doing. And then pull that out. Retract the green safety cap back. Then take the clear cap off. And then you want to pull up the ink into the syringe. Sometimes you have to do this over the trash can to get a good drop of ink. It is normal to get bubbles. So once you have a good drop of ink on the tip of that needle, you're going to use one hand and then slightly go under the skin. So we're done with our tattoo needle. You're going to hear a clicking noise when we use the safety cap. Okay. And then she's going to dispose of it into our sharps container. Again, the sharps container should normally be affixed to the wall. We're going to check and make sure our tattoo took with an alcohol swab. And it did. So if the tattoo did not take and you've tried and tried, you're going to touch your mark up to make sure that the patient has the marking on their skin. And we're just going to show you how to use one of those point guard tapes. They're real tiny. Patients don't normally have allergic reactions to them. But you'd simply put it over your mark and then pull back on the white pieces. And they stick fairly well. And that's it.